I'm Dr. Barbara Bazron, Executive Director of the Behavioral Health Administration. And with me today is Brandon Johnson, who is the Director of Suicide and Violence Prevention, and he is responsible for our Crisis Hotline.
How are you?
Hi, Brandon. How are you?
I'm good.
I'd like to ask you a few questions.
Sure.
What is the Crisis Hotline?
So the Maryland Crisis Hotline is a mechanism of which that we have available for the public 24/7, 365 to be able to do a couple of things. One, to be able to handle any type of crises that the Maryland residents may have. They may be calling for issues around suicide and suicidal ideation. They may be calling for a substance use issue. They may be calling to find services and things that their themselves or their loved ones may need. And so what the Maryland Crisis Hotline does is handle any crises that may arise from the callers, also as well to get them connected to services that may help them further down the road in terms of recovery.
So when somebody calls the Crisis Hotline, who do they speak to and what is their training?
Sure. So they are connected to a local crisis center who has call specialists on hand waiting for them to answer their call. The call specialists have training specifically around mental health issues, as well as substance use issues and crisis intervention training. So they are equipped with the tools to be able to handle many different types of crises, to be able to get the person to a point that they may be connected to other services, as well as be able to set up a plan for recovery after that.
And how are they trained?
So they are trained with crisis intervention management training. So once they are hired by their individual crisis center, they receive intensive training on crisis intervention. So this is everything from how to talk to someone who is calling, information on places that a person can go for further resources, de-escalation practices as well as how to identify risk for someone calling that may be experiencing an overdose.
So the individuals who actually answer the phone are not only trained clinicians, but also they are really aware of the variety of resources that are available within the communities to support citizens within the state of Maryland.
Yes.
Is that correct?
Yes, that is correct. And so the way the hotline works is that through an algorithm, when a person calls, they are connected to a local crisis center that is closest to them. That way, the crisis center that they are in touch with has all of the essential resources, programs, and information that a person can seek that is close to their area. So we don't want to send people all across the state to find resources. We want to get people connected to resources that are right in their neighborhood.
And what are the situations in which that's critically important if somebody's in acute crisis?
So definitely, if someone is in a mental health crisis and is definitely attempting suicide or has thoughts of suicide, we want to be able to send out crisis management teams if we need to. So that's why it's really important that they get connected to a local crisis center that may be able to dispatch these services if necessary, as well as any other emergency situations that may arise at that point as well. It's also critical to have this in place for individuals and family members who are experiencing a potential overdose and need some intensive services in that regard.
And so what kind of problems really come through the hotline? What kind of problems are addressed?
You name it, and we've answered it. Typically, our issues focus around mental health issues. Suicide is definitely our biggest reason for individuals calling the Maryland Crisis Hotline. But we also, of course, with the opioid crisis, have received an increased number of substance use calls for people looking for substance use services. We've gotten everything from connections with unemployment to financial issues, relationship issues. We get calls for just about everything because the crisis means something different to each individual. So when an individual is in that point that they don't know what to do, the crises can stem from a number of issues. And so we get calls for just about everything. And our job is to meet the person where they are, identify the issues that are going on, connect them to services, and get them to a point and de-escalate them to a point that they feel more comfortable to be able to not only manage it in the immediate, but also manage it long term.
What happens if I have a crisis and it's 2 o'clock in the morning?
Oh, we're there. We're there on New Year's. We're there on Christmas. We're there Thanksgiving. We're there all holidays, every day of the week, 24/7, 365. So if you have an issue at 2 a.m., we're definitely there to answer it. Most of our calls that we receive come in the evening hours.
Mm-hmm. And how would somebody even get in touch with the Crisis Hotline if they need it?
Sure. So if someone needed to get in touch with the Maryland Crisis Hotline, the number is 1-800-422-0009. So that's 1-800-422-0009.
And actually, people should know that this is 24/7. There are trained clinicians on the phone to answer their calls and also to connect them to the services they need.
Yes.
How many people use the Crisis Hotline on an annual basis?
So each year we receive upwards of 60,000 calls to the Maryland Crisis Hotline for the number of reasons that we've already discussed, whether it be suicidal ideation, whether it be trying to find mental health services, substance use issues, and just other crises that individuals may be facing in their lives. A lot of people use the resources of the Maryland Crisis Hotline annually.
And is that from all over the state, or is it just from a few areas?
No, it's definitely from all over the state. We receive calls from each jurisdiction across the state, from Western Maryland to the Eastern Shore.
Right, and I would imagine that in the less populated areas that this is really an important service.
It definitely is. In some of our rural communities, you have some social isolation. So to be able to contact a caring call specialist who will be able to help you with certain issues that you're going through is definitely a useful tool for some of our more rural areas.
And now, you know, we're in the IT era, and social media is being used by most people within our jurisdictions.
Yes.
And so how can social media be used to contact the Crisis Hotline?
So we have a couple social media accounts. We have a Facebook account. So it's www.facebook.com/MD Suicide Prevention, and that will connect you to our Facebook account. Our Twitter account, our handle is @MD, the letters MD, Suicide PREV for prevention. So @Maryland Suicide PREV is our Twitter handle.
And so can people contact us using their iPad or the internet or, you know, other devices?
Yes, and I'm glad you brought that up. So we have a new smartphone app called There Is Hope, which is currently available on iTunes and Google Play, the Google Play stores. The keyword to look it up is There Is Hope Grassroots. You type that in, you'll be connected to our free mobile device that we have. And so what There Is Hope does is that it is a suicide prevention app that allows an individual to complete a self-assessment and then be connected to the Maryland Crisis Hotline. There's also some other useful tools on the app, such as how to talk to someone who may be suicidal, risk factors of suicide, as well as some other trainers that may be able to help individuals learn more about crisis intervention.
And so, you know, I think that this is really important, particularly for younger citizens who may be in crisis, because most of them walk with their cell phones
Of course.
and use social media and may not, in fact, use the telephone in the way that we did a few years ago. So I'm really delighted that we have that as an opportunity. This is a good resource within our state for the citizens of Maryland, and this is a way of getting connected to services and getting information and support very, very quickly. So thank you.
Thank you so much.